much weight can I expect to lose after bariatric surgery? This is probably the most common question that Gayle, Isabel, and I are asked. How much will I lose the first month, at 3 months and 6 months, and then a year down the track? Well, what is realistic for you to expect? Are there factors that will affect your weight loss? Coming up, bariatric dietitians Gayle and Isabel join me to answer all your questions. Don't go anywhere. This is going to be a good discussion.
You spoke and we listened. Our chewable multivitamins are now dye-free, meeting your demand for more options. These dye-free chewables join our calcium chews and multivitamin soft chews in the dye-free lineup. Visit ProCareNow.com and use code Susan10 to save money.
I'm bariatric dietitian Dr. Susan Mitchell, ex-radio dietitian turned podcaster. You're listening to the Bariatric Surgery Success podcast. Are you frustrated with all the confusion when it comes to nutrition? Eat this food. Oh, no, don't eat that. Try intermittent fasting instead. Maybe the keto diet. Maybe you should just reset your pouch. It's enough to make you give up and say, I don't know what to do. Well, I know what to do, and Gayle and Isabel do also. It matters where you get your nutrition information. When it comes to your bariatric surgery, nutrition is specific. Let's cut through the nonsense. Let's get what you need to know now. I created the Bariatric Surgery Success podcast to give you accurate nutrition information you can count on. Simple, actionable strategies that work. I want you to feel well every day. Get out there and do the things you want to do. You're in the right place, friend. Let's get started. Are you working hard to prevent that weight regain? Then be sure and add protein sources to your meals and snacks that you actually like and enjoy. Check out my freebie for 10 protein tips that work every day. I'll put the link in the show notes. Joining me today are your favorite expert bariatric dietitians, Isabel and Gayle. These two dietitians stay up to date and know what's going on when it comes to bariatric nutrition. Isabel Maples is a bariatric coordinator at UVA Health in Haymarket, Virginia. Gayle Smith is the bariatric dietitian at the Weight Loss and Bariatric Surgery Institute here in Orlando, Florida. You can find both Isabel and Gayle's contact information in the show notes. Hey, Isabel and Gayle.
Hey.
Well, you know, a couple of the most common questions that all three of us are asked regularly are, how much weight will I lose after surgery? And what is the average weight loss the first 3 months, 6 months, and at 1 year? You want to know what to expect if you go through this surgery and the journey afterwards, and we don't blame you. But there's no one exact answer. Each of you is different, and the surgical outcomes vary depending on which surgery procedure you have. Don't you just hate that answer? But that being said, we can approximate a pretty good idea of what is realistic to expect, right, Gayle?
Absolutely. Yes, life-changing, realistic goals are really important to discuss up front with the patients. And I am asked these questions every day, a lot. So I include establishing weight loss goals and discuss expected weight loss in my very first meeting with the patients, either one-on-one or in person, virtually, or in the classroom with a group. I do stress average weight loss and tell them to expect it to take up to 12 months to 18 months to lose to where they want to stay. I also always tell them to remember that surgery is just a tool, and they will have to do these things. 1, eat healthy and frequent small 5 to 6 meal snacks per day, including a source of protein with every meal, every snack. They're going to have to exercise at least 150 or more minutes per week and include both aerobic and muscle toning to really keep their muscles strong and lose fat weight, not just, to avoid losing muscle weight.
Absolutely.
And take their vitamins daily for the rest of their life and stay away from carbonation.
It is impossible to predict exactly how much each individual person's going to, but those average weight loss goals can at least get people in the right ballpark. Here's one thing I've noticed though. When patients come into our clinic and I ask them why they want to have surgery, the answer is never about weight. It always is about health. They talk about either minimizing
Right.
some health issue,
Uh-huh.
managing it, or preventing it if it runs in their family. But once once surgery
Yeah.
happens, that's what you see is weight loss. That's what you see. That's what the people around you see. So all of a sudden, it becomes the measure of success. Don't let it be. Shift it back to just what Gayle was talking about, your behaviors.
I totally agree with that. So that's why I don't want us. I'm so glad, Gayle, that you said these other behaviors, because I know that we're focused on weight loss in this podcast, trying to just answer some questions that everybody wants to know. But after the surgery and down the track, it's not all about the scale. So I will just say that now. It's just that today we're trying to help you understand so you know what's going to happen, right? So what is the typical average weight loss the first 3 months and then at 6 months scale? Do you base that loss on the type of surgery?
I do. But yet everybody's very similar in the beginning. Why?
Yeah.
Because they're going to be lucky to get 300 to 500 calories per day
Yeah.
for the first month. And then the second month, it could go up to 500 to 800 for some men, maybe even more than that. But by the third month, you're eating more calories. You're 1,000, 1,200 to 15 and upwards. So in the beginning, your weight loss can be crazy fast. Some people, depending on your height, weight, age, and how much you need to lose, can be like a pound a day to 2 to 3 pounds a week. And then it does slow down. And I try to prepare them that the normal weight loss is usually about a half a pound to a pound a week, or 2 to 4 pounds a month. Okay. So I prepare them. I tell them there will be plateaus because they're going to be now starting to add the exercise after the first 4 weeks. They can add the muscle toning to the walking aerobic exercise, and that it'll start to maybe plateau because you're changing some of that fat into muscle, which can weigh more. But to stay the course, they can probably still see a few inches coming off, but does slow down, and that's okay with us. We want to see it slow down.
Yeah. So you see normal weight loss of somewhere between a half a pound to a pound a week, or 2 to 4 pounds a month, way down the track. That's what's a normal weight. That's not in the beginning, but that's what the average person who starts to try to lose weight will lose. Correct?
Correct.
And before surgery, I'll calculate people's excess body weight.
Yeah.
In other words, how overweight is someone? Because you want to compare apples to apples. If somebody has 200 pounds to lose, you would expect them to lose more total weight than somebody who has 100 pounds or 70 pounds to lose. So I'll compare how much weight somebody actually is losing to how much weight they could be losing. And that allows me to see if they're on track or just, need to be patient, or is there something else going on that they are losing weight too fast or too slow.
Yeah. And, I think I want us to make note here about forget about comparing yourself to someone else. And I think social media does a disservice there, because people are always posting, look at me, I've had this and that, and I've lost this much. And you start to see easily that, or think you're failing. And when you compare yourself to someone else, you always lose, and that other person always wins in your eyes. So I want you to remember that this journey is about you and no one else. So keep your eyes only on you.
Yeah, and losing more than half of your excess body weight, or even 3/4 of that excess weight. Like, say, if you got 100 pounds to lose, it's not unusual to lose 60, 70, even 80 pounds during that, and still be right in the normal ballpark. Those numbers are going to vary with the type of surgery, but all bariatric surgeries are going to lead to significant weight loss. But even more than that lower hunger level, especially the first year, is going to allow you to be able to control food better so that you can shift your lifestyle behaviors. Don't think you can't. That's a great time to do so. And then that sets you up for success later on.
And I think that's why the guiding principles, as Gayle called them a minute ago, truly make the difference in not only how much you lose, but how successful you are the first year, but truly on down the track. I call them core principles, guiding principles, core principles, but they need to be put in place from the beginning and followed. So the best plan is to discuss your individual needs in a one-on-one appointment with your bariatric dietitian, if at all possible. Hopefully the team that you've chosen will have that before and after surgery if you can. And actually, I just did a podcast that'll be coming out on looking at these nutrition steps that you can take before surgery, if you haven't had it already, to get yourself in the best possible position. And they're nutrition steps, things you can learn to do about tracking and portions and bariatric supplements, things like that. Right, Gayle?
Exactly. And this may surprise you, but the important focus the first month, couple months, is not calories, because you're not going to get that many, but fluids and protein. I always tell them, aim for that 64 ounces of fluid and you reach 60 to 80, or for some of the DSs, duodenal switches, maybe 80 to 100. Calories will follow, so don't worry about them. They'll be gradually increasing each day. But the fluids you really need to work on, the protein when it starts, usually not the first 3 days in clear liquid, but by the time you get to full liquid, soft diet, the protein grams of protein will start increasing for you based on your individual needs as well. So focus on the protein, then add the healthy first in your meal, then add the healthy whole grains and whole fruit carbohydrates next, with a touch of fat is what I always say, from either plant-based sources like the dry roasted nuts, avocados or a tablespoon of the olive oil can be your fat choices.
Yeah, and when it comes to protein, carbohydrate, and fat, like Gayle, I don't really talk about some of the specifics of that, but sometimes people ask me, especially if they're tracking, here's what I really want people to know. When it comes to the protein, once you get what's recommended for you, whether it be the 60 or 80 or 90 or 100 that Gayle was talking about, what your clinic recommends, more is not always better. We put a lot of emphasis on protein.
Yeah, for sure.
But once you meet your, recommended amount, it's better to actually get foods from other food groups to help balance it out.
Correct.
Starting with those fruits and vegetables, et cetera, like Gayle was talking about. And when it comes to carbohydrates, one of the biggest things I want people to know, if they remember nothing else, is that a post-bariatric surgery diet is not low carbohydrates.
Yay. Thank
Yay.
you. I just want to jump in here and say, yay, low carb keto is not the way to go. So listen to episode 168. I just did this podcast on the keto diet, and I really explain why it's not a top shelf strategy after metabolic and bariatric surgery. You do get to eat carbs. Thank you, Gayle, for saying that. By the way, I'll put that link in the show notes, or you can listen wherever you listen to your favorite podcast. It's episode 168. So go ahead, Gayle. Sorry, I just had to jump in there a minute.
The thing is that we all talked about smart carbs, and that's where I want to get most, and you've got an episode on that you can share with listeners. But smart carbs are ones that are going to give you more nutrition in every bite. And they're going to be, fruits and vegetables and whole grains and other grains too. And even some of that carbohydrate you might get from, milk or yogurt, etc. But the bottom line is that you want to make sure that the carbohydrates you're getting are really going to count, because they may count for as many as a third to a half of your calories for the day. If you're tracking, a lot of times people say, I get 40% of the calories as carbohydrate, but you're in the ballpark. Now, when it comes to fat, I find that you don't want to go real high fat. Really, a post-bariatric diet is pretty low in fat. Maximum of maybe 30% of your calories is fat, for those that are tracking. And that's because if you add too much fat, you either add too many calories or you squeeze out the other more nutritious foods so that you can't get both. So limiting or avoiding fried foods and greasy foods or fatty cuts of meat or whole milk or whole dairy foods, or even ice cream and things like that would have that fat in it as well.
It's really another reason that the keto diet doesn't work. And I'm talking about the traditional keto that's very, very high fat, because you end up having a lot of keto flu and gastrointestinal distress and diarrhea and everything else, which is not what you want after you've gone to all this trouble to have surgery. So that's why protein is so important.
And so that is good because it adds flavor and satiety and the full sense of fullness, but it also can help absorb some vitamin, certain like vitamin D that are fat soluble, but too much and you might end up with diarrhea.
Absolutely. Yeah. I think it really helps to get in this mindset before surgery. If possible, start setting yourself up for success ahead of time. And Isabel mentioned a minute ago that we had some episodes that we have done on carbs. So yes, you can listen to episode 132. It's where we talk about 15 bariatric friendly carbs that for sure you'll want to add into your lifestyle. You can listen to episode 127 where we talk about, can you really eat carbs? That answer would be, yes, you can. So again, those links will be in the show notes or by episode, wherever you listen to your podcast. So Gayle, don't you agree that you should, if you can, start making changes before surgery?
Absolutely. We go over that too, to start making some changes now before surgery. And I always ask them, what is your biggest challenge right now? Then I want to know, are you eating? Because a lot of them don't want to eat breakfast. They just eat more at night. So they wake up full and they don't want to eat anymore. So I tell them, you've got to have something in the morning. You've got to have something with protein in the morning. And you also want to start the day by eating 5 to 6 small portion meals per day with a source of animal or plant-based protein in that meal or snack meal. 4 to 6 ounces each, and smaller as you get closer to surgery.
Yeah, that's very smart.
Yeah, just to get used to that. But stop skipping that breakfast, and then what they do is they barely eat lunch, and then they do get home and eat too much. Change it now. Change the cycle now. And also start doing some exercise, simple things, because some of you have really bad knees or backs, and they can't do a lot of walking. But they may be able to get on an elliptical, or they may be able to get in the pool where they're weightless, or possibly on a stationary bike. But anything they can do, small chair exercise even, light little 3 to 5 pound weights is what I tell them to use. Or think about what you might want to do once you start losing the weight and you have more energy to get out there and do something. So just begin now, begin slow, and also one other thing I tell them to do, start drinking more fluids. Drink water or any kind of fluid that's maybe not carbonated. Try to get off the carbonation, but low in sugar. It doesn't have to be completely sugar-free. And then try slowing down when you eat. Take smaller bites. Do it now, because afterwards you try to eat too fast and everything comes back up.
And you have so much to learn afterwards anyway. So anything that you can do ahead of time makes it easier for you.
Exactly.
Yeah, and tracking does build accountability. We know, studies show that people that track a behavior, whether it's food intake or exercise, but they are going to be more successful if they're tracking, if they're really paying attention because of that accountability. The problem is I get some people, some personalities that aren't necessarily list makers, and they're like, Isabel, I know I should, but I can't. Well, here's the good thing. You can take it in pieces. And what I mean by that is soon after surgery, forget about tracking everything. If you're just tracking your protein and your fluid, as Gayle was talking about how important that is, I am so happy because that really helps that. But the other thing you could do is if you're a person who may fall into a pattern of either nibbling and grazing or skipping meals, track. How many times am I putting something in my mouth? And because we don't want you nibbling and grazing through the day, and we also don't want you, skipping meals. Or maybe what you do is spot check. So you're not going to track everything you eat every day. But what if you did it for 2 or 3 or 4 days at a time and just kind of got a snapshot of what you're doing? Especially if you include work day and non-work day. So that gives you a better feel. Or If you're really not going to do any of those things, maybe what you do is take a picture of what you're doing, what you're actually eating.
Good idea.
Yeah.
And then it only makes sense if you're actually sitting down with it, like maybe at the end of the day or the next morning or at least once a week.
Yeah.
And saying, okay, what is this really showing? Am I getting protein? And get a feel for how often you're eating. Are you eating 3 times a day? Which I'll tell you, you're not going to be getting your nutrition if you're only eating 3 times a day. Or are you eating 10 times a day? Or are you taking 2 hours to eat a meal?
Mm-hmm.
So look at those behaviors like that.
And it tells you a lot. If you will do those things, you will learn a lot about yourself and the things that you're doing and where you need to tweak. Another common question we get asked is, okay, I'm 3 months out and I've hit a plateau. What can I do? Well, these stalls are to be expected, right, Isabel?
Oh, yeah, you start with expecting a stall. It's going to
For sure.
Mhm.
Just know it's coming.
You're losing weight at the rate that Gayle was talking about. Every time you get on the scale, it changes. And then all of a sudden, nothing changes for 3, or it goes up. It can be hard on your ego, but that is normal. That is what your body does to make sure you're not going to starve to death. Your body will figure it out and keep moving as long as you focus on those behaviors, that Gayle's talking about. But at the 3-month mark, it might be kind of a time to really take a good assessment of what you're actually doing versus what you think you're doing. For instance, are you getting the minimum of 60 grams of protein? I mean, maybe you are. You're able to eat more food at this point, but I find that sometimes as people shift to more solid food instead of the protein shakes, they get filled up more quickly, or it's really uncomfortable because they feel like I have a brick in the stomach because they take that one extra bite, but it's so uncomfortable. And that's the reason I really try to get my patients to look for the first sign of fullness and know when to stop. And also not to avoid that fullness feeling, but instead to learn to manage it. So you sit down, you eat a meal, you get full, you start to tell that your hunger's down, your satiety's up, and you stop. And that's, I find, the way to stay comfortable and still be able to get enough protein. Otherwise, I find people getting into a couple of patterns. One is that nibbling all day long so they don't get full. And then,
and they take in too many calories sometimes.
Yes.
The more you nibble, the more the calories come in.
What I eating amnesia. It may not happen right at the beginning, but later it can happen where you think you're not even hardly eating anything, but the reality is you're eating probably more calories than you think. And those foods that are high in protein, again, get you really full. So it's hard to keep nibbling those. So you shift to either low fiber or, lower protein foods. And then you can keep nibbling, like something like a cracker, for instance. You can kind of keep nibbling, and it's not digested as much in the stomach. So therefore it's easy to kind of keep nibbling on pretzels or something.
Yeah. And the other thing is we try to get patients not to drink and eat at the same time. We call it like the 30-30 rule, because you can fill up on the water and then not get your food in. But more importantly, I find that people tell me in the beginning, you throw everything up. And then as time goes on, you won't throw everything up, but you'll feel like just really uncomfortable, like you wish you could throw up. Yeah. So you got to be careful with fluids and definitely empty calories like that are in the fluids. But usually we don't worry about that because we've already got you off the soda carbonation for now. So that's not usually a problem. But we definitely don't want you going back to drinking carbonation because that can actually, over time, the research still out, but it could cause a little bit of light stretching of your stomach and then cause you to want to eat the wrong things too much, too often, that kind of thing.
I think that's very interesting, the research that's coming out. I want to touch on something, Gayle, too, that I think is really important. So let's talk about alcohol.
Oh, alcohol. I've got great stories from every patient, not every patient, but quite a few patients will come back to me and say, thank goodness you told me to be careful with alcohol because it goes boom straight to your head. And then you're wondering where you're at. And some of you are out like a light for the night. If it is hard liquor, that is hard to do. But if they do want to have alcohol, the ASMBS says, American Society of Metabolic Bariatric Surgeons tells us to tell them to wait until they're at least 4 to 6 months out from surgery. And then if they are going to try a little bit, it's got to be a small pour, a drier red or white wine, a skinny taste, less sugar mixed drink. And again, shots or 911 is what I hear from everybody. So don't do that.
It could truly be 911.
Yeah. And it has a lot of calories too, right?
Yeah,
alcohol?
Absolutely.
Oh boy. Yeah.
The thing is, here is really have that extra time to lose weight. And so you don't want to have to go with those extra calories at that point.
I agree. Plus, the alcohol buzz, you need to know about it. So
Yes.
if you want to listen to episode 30, we talk about the alcohol buzz and what you need to know because it's no joke and it happens really quickly. Okay, we can't forget the link between exercise, muscle mass, and weight loss. So, Gayle, these new medications, the weight loss medications or obesity meds, as we call them, let's talk about those and bariatric surgery both.
Yes. In fact, I've had a couple patients that have been on some of those and that might have been even after their surgery. They're trying to lose a few more pounds 2 years out or so. And we're finding that these GLP-1s and others really do require you to take that protein, that same 60 to 80 or 80 to 100. I had a person that had to get up to 150. I mean, it just depends on the patient to preserve that lean muscle mass and not lose that, but continue to try to lose the fat slowly. So yes, and some of the protein supplements that are coming out now are being studied in more detail, and they're stating that they preserve that lean body mass because they have an additive called HMB, some of them, which is the beta hydroxy methyl glutathione.
Yeah.
That does, preserve the lean mass and allows you to lose more of the fat mass.
And I think we're going to hear, so you heard it here first, if you haven't already, from the three of us, but I think what you're going to hear more about from us and from any bariatric dietitian as we learn more is that weight loss is not just fat loss. It's water loss. It's fat loss. It's protein or lean muscle loss. And so when you lose, the more you lose this lean muscle. That is your fat burning machine. It is what you want to keep. So the bariatric surgery and these medications, we have to find ways through your lifestyle to make sure that you're fed in a proper bariatric diet that will maintain and preserve it. Otherwise, you need even less calories. That's why you hear both of Gayle and Isabel saying you've got to start exercising. You've got to start doing weight training so that you maintain and build additional muscle mass. So I think there's going to be a lot more to come on this. Don't you guys?
Yes. Yeah.
Okay. As we wrap, any last thoughts, anything that we've missed that you both want to either bring up?
Yes. I always tell patients that I do recommend vitamins for life. I mentioned that in the beginning. I'll mention it again. And the bariatric brands are fantastic right now because they follow the ASMBS guidelines for the specific nutrients, and they now put them in like 1 per day or 2 multivitamins per day with or without iron. And then you just need a separate calcium citrate or 2 to take that up to 1,000 to 1,200 to even 1,500 milligrams of calcium for some patients. That's my last thought.
A good one. And a good one. Isabel?
I mean, be patient with yourself and with your body, but also stay in contact with your clinical team, your dietitian, your surgeon, et cetera, so that you've got those regular follow-ups, particularly that first year, and then on at least once a year after that. So you're right on track.
I love it. Thank you. As always, I so appreciate both of your time. I know you have busy schedules in your clinics, but the information is so helpful and so spot on. Thank you.
Welcome. It's always fun to see both of you.
Totally.
And remember, you are unique. Your surgery outcome and the weight that you lose are both specific to you. Weight loss is never a straight line or a simple answer. It's learning to make changes, adapt, and make more changes as needed because you are worth it.
Bariatric Surgery Success with dietitian Dr. Susan Mitchell is produced and owned by Practicalories, LLC. All rights reserved. Remember, the content provided on this podcast is for information purposes only and doesn't create a patient-provider relationship. It's intended to provide reference material and is not designed to provide medical advice. Please consult your healthcare provider regarding any medical issues you have relating to symptoms, conditions, diseases, diagnosis, treatments, and side effects. Podcast guests express their own opinions, experience, and conclusions which do not necessarily reflect or agree with the host, Dr. Susan Mitchell or Practicalories, LLC.